Secretary Gibson, welcome. Since our last hearing, there have been several developments related to the scheduling irregularities across the VA and its negative impact on patient care. VA has begun to take the necessary steps to address the systemic problems and the corrosive culture that have been identified and substantiated by several independent sources. However, these changes will not happen overnight, and this committee must provide the critical oversight to ensure those changes occur and are effective. Even with the steps VA has taken to improve access for many veterans, there will continue to be reports and allegations regarding VA healthcare facilities and workers. These reports will not only highlight critical areas of needed reform, but identify the magnitude and the breadth of the systemic issues facing the VA. The ongoing internal evaluation by VA, as well as investigations currently being conducted by the Office of Special Counsel and the VA's Office of Inspector General, are essential to rebuilding not only veterans' trust, but also the trust of stakeholders and employees. To undertake the needed reforms within VA, the role of the Office of Special Counsel and the Inspector General are even more crucial now than ever before. Both offices have been essential in identifying systemic issues facing the VA. I'd like to highlight a few critical reports that have been released since the last meeting. At the time of May 15th's hearing, there were several stakeholders who did not want to rush to judgment until the allegations surrounding Phoenix had been substantiated. Since that hearing, the IG released an interim report regarding the allegations of scheduling irregularities and a secret wait list at the Phoenix VA healthcare system. Not only did the IG substantiate scheduling irregularities and a secret wait list at Phoenix, but the IG identified roughly 1,700 veterans who were waiting for appointments and were not included on an appropriate electronic waiting list. The IG found that scheduling irregularities are a systemic issue across VA's healthcare system, and that this was not an isolated event. Additionally, the IG has received numerous allegations regarding, I quote, mismanagement, inappropriate hiring decisions, sexual harassment, and bullying behavior by mid and senior level managers at this facility, unquote. These allegations speak to the corrosive culture that has taken deep root throughout the entire department. Within a 3-week period, the Office of Special Counsel released a statement on VA whistleblower reprisals and sent a letter to the President regarding VA's lack of responsiveness to OSC requests. In this letter, the Office of Special Counsel described the Office of Medical Inspector's consistent use of, and I quote, harmless errors, unquote. This is their defense, where the department acknowledges the problem but claims patients weren't, their cases were unaffected. The letter details 10 cases of egregious patient care provided by VA facilities in which the OMI substantiates errors in patient care but dismisses potential patient harm. In one case, 2 veterans were admitted to an inpatient mental health ward at the Brockton VA facility, didn't receive comprehensive evaluations for more than 7 years after being admitted to the facility. Another case in the letter describes how a pulmonologist copied previous provider notes in more than 1,200 patient medical records instead of recording current readings for these patients. I want to be crystal clear. The culture that is developed at VA and the lack of management and accountability is simply irreprehensible. And it will no longer be tolerated. Secretary Gibson, you've taken several actionable steps in the last month and a half, and I commend the work that you've done. However, what has happened over the course of years is a horrendous blemish on the VA's reputation, and much more work will be needed to repair that damage. As VA continues to move forward in improving veterans' access to care and changing the culture that has taken deep root within the department, this committee has a lot of work to do. The committee needs to take an active, vigorous oversight role to ensure that the problems that have been identified over the last several months, and I might say over the next several months as a host of IG reports come out are effectively and appropriately addressed, and they aren't allowed to happen again. Again, Secretary Gibson, thank you for being here. Mr. Chairman, I thank you. I yield.